Hello guys, today I'll be recording a video on ADC part 2, the general way you should be approaching your OSCEs, the communication OSCEs part. I wasn't planning to do this today actually, but one of my previous candidate who cleared his part 1 and is appearing for part 2 kind of requested in the morning. And though I'm not taking any part 2 coaching classes as of now, because it's too much to manage a lot of things. Of course, I cannot like refuse any request. I love to help, and he requested with having faith in me. So there I go. I'm recording a video, and I hope it helps you out. See, the way I approached my OSCE, so for all those who are listening for this video for the first time, I have given my part 2 exam and I cleared in my information gathering and clinical treatment OSCEs, all four of them. And in diagnostic, I cleared one station and in one I could not. So, since I've cleared the information gathering, so you can take this as a legit way of doing that, at least. Anyways, so it's a complex way to approach the OSCE, but I've tried to simplify it as much as I could. So, of course, you need to read a lot, and there are around 66 to 67 scenarios in general, which you must revise at least 3 to 4 times. And this information I came to know about 2 days ago before I was going to give my own exam. I'm giving you out right here. See, there are 6 stations in the exam, okay? 1, 2, 3, 4, 5, 6. The first 2 stations, that's 1 and 2, are information gathering. 3 and 4 are diagnosis and management, and 5 and 6 are clinical treatment and evaluation. Okay, so you may not start in the sequence of 1, 2, 3, 4. Your station may be 6, like how it was for me. My first station for the exam was 6. But since I knew this thing that 6 will be clinical treatment evaluation, I was mentally prepared. And you need to be mentally prepared because it's a very short time in the exam. Like you'll be very confused if you are not mentally prepared. So, in order to simplify the OSCE scenario, I had prepared a template in my mind and I used to practice according to it, which simplified a lot of things. So, how it is when you enter the room, on the left hand side, there is a big screen, like 55-inch screen, and on that, a scenario is mentioned. There will be a picture or there may not be a picture, and a big scenario is mentioned. On the table that you'll be sitting, which would be just as you enter, there would be a chair and then there would be a table in front of you. On the other end of the table, there would be the examiner wearing a mask. And on the right side of that examiner, there would be a partition, a glass partition. And behind that glass partition, another examiner would be sitting with a mask and he would be having a tablet in his hand. So that guy is the one who's going to score you. And you can't see what he's scoring, of course. So the person you're supposed to interact is the one who's sitting at the other end of the table, and he'll be wearing or she'll be wearing a mouth mask, and they will not utter any word. The moment you enter, they'll just check your ID and your time would start, and there would be a clock ticking on the screen for 3 minutes, and it's a 13-minute clock actually. So the first 3 minutes are for you to go through the scenario and prepare your own notes. There would be a pencil and a paper in front of you. So what I did, the moment I entered, I showed my ID and I just said hello to the examiner and I sat, and you have to twist your head completely towards the left to read the scenario. Make sure you read it fully because then you have to look straight in front of the examiner as you would be you would be making a conversation basically, sorry. You would be making a conversation with the examiner, and then it would be very unprofessional if you again look back at the screen, because then you'll be losing an eye contact and hence the marks for effective communication. Yeah, there is a criteria called as effective communication on which they grade you. If you fail that, you fail the exam. So I cleared my effective communication anyways. So I've given my result on Facebook, like I'm not a person to hide anything. I've put my entire result up on my Facebook target ADC group. You can go and have a look. So, yeah. So what I did the moment I entered, there's a short notepad. I ripped one page because I knew I would need two pages. So I ripped one page and kept it right next to me. And with the pencil in hand, I just made this template even before I started reading the scenario. Now, this template is going to be very, very useful to you. See, this is my own creativity, imagination, discovery, whatever you may call it. I've not taken it from any person, and this is my original thing, and I'm sharing it with you. If it helps, great. Let me know that it helped you. I would be happy. All right. So, this is the short form. Shipped, SHIPT. Now, the geniusness of this template is that you can use it for all the three communication OSCEs. That's information gathering, diagnosis management, and clinical treatment evaluation. You don't have to keep changing your template for different clinical scenarios and burden your memory with extra stuff. So, the geniusness lies in which part to focus more. Now, I'm giving you an example. Okay. So the first moment I entered, I just wrote SHIP and P. Okay. Now, what does S stands for? S is for summary. H is for history. I is for investigation. P is for probable diagnosis or diagnosis, and T is for treatment. Now I'm going to write this spacing at least three fingers apart. Okay, I write S, gap of three fingers, H, gap of three fingers, I, gap of three fingers, like that. So that on the right, so on the left side I write this, and on the right side I have all these things. So I made a synonyms of all these also, but let's just focus out here first. So, suppose it's information gathering. Now, information gathering will not have diagnosis and treatment part. So, though I have mentioned that in my template, I would not be focusing on these two things. Okay. My main concern would just be S, H, and I. Understood? When there is a station for diagnosis and management, I would have a short variation of S, H, and I, that is summary, history, and investigation, would be a very short duration for me. Like I would like to wind it up in 4 minutes, and the rest 6 minutes I would be keeping for my diagnosis and treatment because that would be my major station to do. Okay. So all these details which I've given here will become very brief, and my diagnosis, which would include my risk factors, and treatment, which would include my short and long-term follow-ups, would come into play. I've not mentioned too much here because I'm going to say about it a lot. Okay, so you'll come to know what I'm trying to say. And when I come to treatment evaluation, again, my S, H, and I would barely minimum, and I would be mostly focusing on P and T. That's diagnosis and treatment. Now, in diagnosis here, I'll come to that station. I will add it, but in general, for your this thing, I'm going to add risk factor pathogenesis. I will describe this in detail when we come to those questions. Okay. So let's see what this is all about. Now, S stands for summary. See, whenever you're going to any station, how you're going to start your communication. See, you have a limited time. You just have 10 minutes, and in that 10 minutes, you have to say a lot, and you also have to give the examiner to say something. And you have to make sure that whatever you say is understood. Plus, you will also take time in understanding the accent of the Australian examiners. They are heavily accented. Sometimes you may have to also say, pardon me, can you repeat it again? Because you wouldn't understand. Sometimes the examiner is deliberately too slow, or he's deliberately too less in volume. So you have to pay extra attention to hear. So if you're paying attention there, your brain is virtually stopped. So you need to have a lot of practice for communication aspects. So anyways, so S stands for summary. Now what is summary? So in order to save time, once you have read the scenario, and suppose the scenario says that the patient is in pain since 3-4 days and has come to you for blah blah blah, you would start by addressing the patient as, say, Mr. X. Mr. X, thank you for coming in today. I'm so sorry to know about the pain that you're having. I believe that you're having pain since last 3 to 4 days, and this is what is happening. Basically, you're just repeating the scenario, rephrasing the scenario. Is there anything else you would like to tell me about the pain? Okay. So if the patient says no, or there's nothing more to add to the chief complaint, there, you just did your summary and in that one sentence, and you're done with that summary. Summary is very important because you're going to greet the patient. You're going to address the patient by the name. Okay. If no name is mentioned, then you would ask the patient, may I know your name? And then you're going to address the patient. You understand? And you don't have to be overly sympathetic. You can just say, I'm sorry, but be genuine in the way you are saying it. Now see my tone, how I'm talking to you right now. I'm not excited. I'm not nervous. I'm just a normal professional who's confident and who's empathetic towards your situation. And I'm appreciating you that you're doing something nice by coming out here because you're actually trying to help yourself. So, this is how the tone should be. So, thank you, Mr. X, for coming in today. I'm sorry to hear about the pain that you're going to go through, you're going through. I'll do my best to help you out today, and I believe that you're having pain since so and so many days. Is there anything else you may like to add? The examiner might say yes, might say no. Just listen properly. Now, once that is done, now history. Now I'm going to give this out in detail. Now, I will now the further progression of this session of my video today is based on information gathering. So my entire template of today, I'll be focusing more on investigations and information gathering. I am not going to discuss much about diagnosis and treatment. That would be another video for another station, that's diagnosis management, and a third video for the clinical treatment and evaluation. So from now on, whatever I'm going to say, we are going to stick to assuming we have a scenario of information gathering. At the end of this template, I will show you an example of how a case is asked with the picture and how I would communicate with the exam. And this case that I'm presenting was my own exam case of part 2. So that's about it, okay? So let's start. So in history, uh, I would ask the patient, like, since when did the pain start? So in the history, the first thing that you would start is the pain history. Now in this history format, this is, you see these things: pain history, dental history, medical history, social history, family history. In any information gathering case, you must ask all these things. So the moment you have taken the pen and paper when you entered your exam, you wrote S, H. You remembered I said leave a 3-finger gap. So when you left a 3-finger gap on the right hand side, you're going to immediately write P, D, M, S, F. Pain, general history, medical history, social history, family history. Now you write the starting initials of this so you don't forget it. Okay. So like asking the patient, I'll be like, since when the pain is present? Is this the first time the pain is happening? Is this pain spontaneous? Did you give any medication for the pain? After the examiner has answered these questions, I would move on to the dental history because I've covered the pain part. Now, in the dental history, I would ask, is this the first time you're coming to a dentist, or any previous dental treatment was done before? Does the water in your area have fluoride? Now, in children, you would be asking this question. In adults, it's okay if you quit the fluoride part. Once the patient has answered this, then you move on to medical history. You always will go by sequence. Now, the sequence you will remember only after practice. So, always on the notepad in front of you, the first 3 minutes are very crucial. Write down all the initials of this template. Okay, so then you know you are going sequence wise and you're not missing out on anything. And when you have a structure, you're likely to be more confident and not get confused in front of the examiner. Understood? So once the dental history is done, then you move on to medical history. Is there any medical disease your child is suffering from or you are suffering from? And any medication is going on at the present moment? If the patient says yes, then ask when was the last time you have consulted your GP regarding it and how are you doing about it. If the patient says there is no medical history, there is no allergy, fair enough, move ahead. Social history. Social history in terms of children will not be applicable, but in terms of adults, always applicable. And again, further synonyms of it are there, or rather acronyms. Synonym is the wrong word, it's the acronym. SADS, SADS. You see this? You will always ask the adult patient, are you under stress? Is there any history of alcohol, recreational drugs, or smoking? If the patient says yes, just tick mark on your sheet so that it might be useful for you in the further diagnosis and clinical management. But in case the patient says yes, you must add this line, have you ever thought about quitting it? In case you need any help, we are always available to help by giving you the quit line number. And I know it's a difficult process to quit, but with a lot of help and support from around you, you'll be able to do it in case you wish to. So, like this, you're supposed to say, don't just move forward if the patient says yes, there is a smoking history, and you just tick mark and go ahead. No, you will add this line. Otherwise, there is no point of asking smoking history. And last is family history. Now, family history becomes very important when there are gingival diseases, but in general, also, it's always good to ask the family history. And like, does your family, any of your family member have any of the medical diseases that you're aware of? So once you have done with this all history, now this history in the exact sequence that I have mentioned should be done in any information gathering case. If it's diagnosis, management, and clinical treatment evaluation, you can just stick to a brief pain history and social history and move on. But in the first information gathering, that is the first time the patient has ever come to you, you're going to take a detailed history, and this is the template for it. Once you're done with this, then you're going to say, thank you so much for answering all the questions and being patient with me. Okay, this is the line. Now, here is your thankfulness, appreciation. So, in one of the rubrics of OSCE communication is, of course, effective communication, your eye to eye contact. After that, they really value you being empathetic, in which you have already mentioned, I'm so sorry to hear about the pain, and your appreciation that thank you so much for answering all these questions. So you don't have to be overly, like, you don't have to say sorry 3 4 times in your 10 minutes, or thank you so much time, in the 10 minutes, but once or twice that you have said it, generally will give you more marks, definitely. Now let's come to investigation. Now, an investigation, because the patient has come to you for the first time, an example, it's any lesion. Let's assume it's a carious lesion. This is the template you will follow. Again, in investigation, I had said leave 3 lines, 3 finger space. So on the right side, you're going to write clinical examination. So how you will proceed is, so example, the patient came with a carious molar. So you will tell the patient, in order to help you out in the best way possible, I would have to do certain investigations. You would mention this word investigation. I would like to explain more about you if you're okay. The patient will say okay. So then start explaining. Now, see, in investigation, you will not just say, I'll do a clinical examination, I'll do a palpation. These are clinical terms. You have to explain to the patient exactly what you're doing. So you will headline the term, say, I'll be doing a clinical examination, and then you will describe that process in detail. In detail means in a line, not take too much time, of course, in layman terms. So this is how it goes. Clinical examination. So I would be checking clinically the concerned tooth. I will look if there is any swelling next to it. Then I would be doing a palpation, meaning I would be just holding a tooth with my finger and a thumb, or the back of my mirror and one finger, and just see if the tooth is wobbly. Then I would be taking a small metal instrument and probe around your tooth just to see if there is any crack or there are any pockets around the tooth, that is the space between the gums and the tooth. Then I would gently tap onto your tooth with the back handle of my mirror just to see if the supporting structures are healthy or you feel any pain. And then I would be testing the integrity of your tooth, basically checking the nerve status by putting a hot or cold water or ice, and see how you respond to it. So these are the tests I would do, and after that I would be taking a digital picture of your tooth, that is what we call as a radiograph, in order to understand what is happening within the bone and the surrounding structures and the tooth root itself. So this is how you will be giving the investigation. Now this I've given a general template. If there is any other lesion, suppose example, there is a mucocele or there is something that needs to be excised, then in the investigation you would be mentioning the biopsy and whatever. So as and when we'll be discussing the scenarios, I would come to that. But this is the basic investigation. So in short, whichever investigation you think is appropriate for your station, you would say the name of it and then you would describe that. Understood? Now, once that is done, the patient might ask, so doctor, what do you think it is and how would you going to help me? Now, based that this is an information gathering cluster, you cannot give a diagnosis because you have not done any investigation. You have just discussed them. So, what you're going to say in such a scenario is that based on the results of our investigation, we would be determining the treatment. Now, various results can be obtained. Then you can give an example. Like, for example, if we think that the decay portion of the tooth is just limited to the tooth structure and not reaching the nerve, we can just clean the tooth and put a white colored filling material. But if we think on the x-ray, if we find that it's reaching the nerve, then you have the option of either removing the tooth or getting a root canal treatment done. And then you describe those procedures also so that the patient understands. So you will never ever say, okay, this would be the diagnosis, just basis on the picture that is presented to you on the screen because you have not done any investigations, right? So this is how you move forward. You understand? So this is a basic template. Now let's move on to a case and let's discuss this, okay? So this was my own exam case. This was my station one, and here it was mentioned. This was a scenario written. Jack, a 5-year-old, presented to you with his father today with pain in the left lower tooth. Father is very concerned about the cavity. Gather information and manage patient concern. Now, this was also written in black, but I have made it red in color so that to make you understand that this is the main question. Now, no matter how good I am, if I fail to address this part, I fail in that station. Okay. So, very importantly, read the last line of your scenario always. So, this says gather information and manage patient concerns. So, it's an information gathering station. Manage patient concerns means whatever question the patient might have, uh, I have to answer them. I should not just keep on going and going about the information that I have. I have to gather information here, not provide the information out here. You understand? So I have to ask the right questions. Now, this also means that I should not be asked any irrelevant questions. Okay, I have to stick to the scenario and ask the relevant questions. You understand? You don't have to be in a rush to ask thousands of questions. Even if you ask 10 right questions, you're good. You have to be calm. You have to have a cool demeanor. You just be relaxed, like how you manage any patient in your own clinic. You are working there as a clinician, not as a student, not as a candidate. You are the dentist in that room, and the person sitting in front of you is your patient. So have that authority that you know it. Don't get nervous. There is nothing to get nervous. What will happen? They'll fail you. Big deal. You'll not die. You'll survive, right? So just be confident because they'll catch your nervousness and then they'll trap you. You understand? So let's start with the station and always you practice with a timer on. Okay. So here, as soon as I walk in, I say hi, I show my ID. This is seen on the screen. I take that notepad, take a paper off because I need two papers, and I start writing my template. Now, where is my template? My template is here. Okay. So I have written everything in my template, and once I'm ready, the time is over. I'm like, thank you so much for coming in today. I understand you have come here with your son Jack. May I know your name? Here the examiner answered me as Abat. So I was like, thank you, Mr. Abat, for that. I understand that you're very, very concerned about your son. Rest assured, he's in good hands and we'll take good care of him. But to do that, I would like to ask you a few more questions if that's okay with you. So here Mr. Abat says, yes, please. So I'm like, so can you describe me since when the pain is happening? So he says it's been there for a week or so. So then I ask, is the pain there on just biting or is it there at night also? So he says it's mostly on biting. So then I'm asking, was this pain there before, or this is the first time your child is having it? So he's like, no, no, this is the first time. It was never there before. So then I'm like, understood. So is the pain aggravated by eating something hot or cold, or just by any other food? So he's like, no, mostly when he's biting on that side, and sometimes when he eats sweets, he kind of complains. So I'm like, all right. Have you given any medication for that? So he's like, no, we didn't think the need for it, but we thought it's good idea to get a consultation done from the dentist. It's high time. So I was like, yes, you made a good choice and thank you for that. So does the water in your area have fluoride in it? You think Jack is consuming water having fluoride? Are you aware what is fluoride? So he's like, yes, yes, I'm aware of it, and our water does contain fluoride. So I'm like, okay. Can you describe me in a bit more detail how is the brushing habit of Jack? So he says he brushes twice like any other child, sometimes a bit lazy at the night, but just often on and off he does it. So I'm like, all right. So then I say, is there any other medical history that you would like me to update about? Is Jack taking any medicine? Is he allergic to something? I was like, no, no, there's nothing. We're all healthy people. We just have somewhat of sweets, but nothing as such. So I just kind of like smile. I'm also wearing a mask, but when you smile, your eyes also smile. So it's like you're participating in the conversation. So then I'm like, just a few more questions, please. Is there any other sibling of Jack who also has the same things, or this is the first time Jack is having it, like in your family? So he's like, no, no, he has a sister. She also had a couple of cavities when she was younger, but now she's old and all the milk teeth have fallen off. You were wondering if this tooth is also going to fall off soon. So then I'm like, thank you so much for answering all these questions. Well, you don't have to worry. What we see looks like a cavity, which a normal lot of children have it. But in order to treat this tooth properly, I would like to do some investigations because only after that I can give you a correct idea of what we can do about it. So he's like, okay, tell me about it. So I'm like, so the first thing that we would be doing is we would be checking the tooth from every side. We would like to see if there is any swelling. We would like to see if there is any other tooth in the mouth which is having the same situation. After we have done the clinical examination, we would just take a mirror handle and a probe handle and we'll just try and see if the tooth is wobbly or not. After that, we would just take a blunt metal instrument and we'll probe the tooth. Basically, we'll just move this instrument around the tooth and see if there is any crack or any other hole, and if there is any space between the neck of the gums and the tooth, just to see if there is any pocket formation. So, are you with me? Are you understanding this? So the father would be like, yes. So then I'll be like, further moving on, I will just take a blunt end of the mirror and just tap the tooth gently to see if the supporting structures of the tooth are healthy or if Jack is having pain in them. And lastly, I would be just trying to test the integrity of the nerve, though this is not reliable in children, but that would help us to maintain a baseline record. So he's like, all right. But then he says, but doctor, do you think my son can be treated? So I'll be like, yes, yes, of course, why not? We'll see how Jack is managing himself on the chair. If he's not able to manage himself, then we also have a pediatric dentist on call. A pediatric dentist is the one who deals with children. They have better skills and instruments to handle children in case Jack is a little uncooperative, which at his age would be normal in case he chooses to do so. Also, I would like to inform you that I have to take a digital picture of the tooth to see the structures inside and to see if the roots of the tooth are nice, if the surrounding bone is nice, and if there is a new tooth which is developing inside. Is that okay with you? So at this stage, the parent says, yes, it's okay. And then he's like, but doctor, so what are we going to do today to help him relieve of the pain? Then I'm like, after we are done with this investigations and based on the result of this investigation, we would inform you about the treatment options. Unless we do the investigations, we are unable to tell you what exactly is happening. So I'm sorry, but I cannot give you a definitive answer as to what we are going to do today until I have the result of the investigation. So the father is like, okay, I understand that, but just in case, what are my treatment options? So in that scenario, I'm answering him. See, depends on the investigations. Now, for example, if the investigation result shows that it's just a small cavity, just in the first and the second layer of the tooth, and it's not approaching the nerve, then all we will do is we'll just numb the tooth a little bit so that Jack doesn't feel any pain. We'll clean the tooth with water and our drill, and we'll just put a cement, which is like a white colored filling material, and we'll just check the bite, and if Jack is okay, that would be it. But in case we feel the caries portion of the tooth, that's the bacteria, the bugs inside the tooth, have eaten the nerve away, in that scenario, we'll have to check if the tooth can be saved or not, and we'll give the option of either doing a nerve treatment for the tooth or removing it. But that all depends on the result. Now, at this moment, my 10 minutes were over and the bell rang, so I was like, thank you so much. But in case you still have time, you can just go on and ask, is there any other concern you would like to talk me about like this? In case you have finished talking and you still have time left. So you see, when I was talking, here the examiner wasn't there, of course, but in between, I paused to gauge his reaction. I was throughout looking at his eyes. I never took that time off. Only when I was talking, I just looked for a fraction of a second on my paper to see if I'm following the structure of my template. But I made sure when the examiner was talking, I was full time looking at his eyes, so that he feels that I'm connected and I'm paying full attention. So I hope this video helps you out. This is how a clinical information and gathering cluster would go. Things would be a little different with the diagnosis and management and the clinical treatment and evaluation. You also have to keep looking at the time now. The time is extremely on your left side, so you have to literally turn your head. You cannot even look with the corner of your eyes. So you have to somehow manage all those things. And then you get tired after the station because you have been talking for 10 minutes and listening with full concentration. And once you come out, you just barely have 2 minutes before your next station, and your next station also happens to be your communication OSCEs. Boom, wow, you're gone. I had 3 stations of communication OSCEs back to back. So the moment I came out, I just rushed for water. There is a water filter kept there. So I rushed for water, I drank water, and then I went and stood outside the room of my next station and just took a breather. So no matter your station went well or bad or worse, you just have to forget everything and start focusing on your next station because it's right up in next 2 minutes. I hope this video helps. If it did, just let me know. Thank you so much.